Thank you so very much. Carotid artery disease occurs when fatty deposits clog the blood vessels that deliver blood to your brain and head. These blockages increase your risk of stroke. Dr. Greg Silverman joins us live to discuss this further. Dr. Silverman, always a pleasure seeing you.
Good morning.
What are some of the symptoms? What are the things that lead up to this that we can cut back on or that we should be paying attention to?
Well, remember, anything that has to do with atherosclerosis or blockage of your arteries is one of the risk factors. So tobacco abuse or smoking, diabetes, obesity, hypertension, sometimes genetics, but most of the time it's really more of a lifestyle issue.
And so confronting that, how do we, what are the indicators? How do we know something's going on? Is it one of those it's too late and you're already being sent to the hospital, or are there warning signs?
Well, not really. That's the problem is carotid artery disease really doesn't have any symptoms until it gets severe. And when I say severe, I mean that the blockage is over 60 or 70% of the diameter of the vessel. So what happens is you can get the vessel so narrow that it causes blood clots, and those clots go to your brain. A stroke or a TIA, or a transient ischemic attack, is just a stroke that sort of dissolves itself within 24 hours. So if you have any of those kind of symptoms, it's really one of those things where your physician or your healthcare provider has to be aware that here's your risk factors, let's take a look. And there's very easy ways to take a look at it. Either put a stethoscope over it. You can sometimes hear a bruit or a murmur over your neck. The easiest way to check is an ultrasound in a radiologist or a cardiologist's office. And you understand and you can see how narrow the vessel is.
Just how common is this in our area? And also, it's kind of my understanding it affects more men than women?
Well, that's a good question. And up until about age 75, it's mostly men. But after age 75, women pick up too. And that's about the same thing as heart disease. It's the same thing in where up until about 55 or so, it's mostly men. But after 55, women start catching up to the numbers that are the same across the sexes. So, and it's around the age, as you get older, the more common it is.
I know it's a discussion a lot of people need to be honest with their
Correct.
doctor and not just rely on those tests to pick it up. Dr. Silverman, always a pleasure visiting with you. Thank you so much
Thanks,
for your
John.
insight. Absolutely.
Bye-bye.
If you have a question for the good doctor, send us a text at 361-855-6397.